All right, the training for top-level managers put together by the National Institute for Policy and Strategic Studies, facilitated by African Development Studies Center, has brought several big shots from different parts of the country. Oh yes, I'm seated with one of them, and is Professor Ruben Agbons FADE, who is the Chief Medical Director of ERA Specialist Teaching Hospital in Edo State. It's nice to have you on Souq podcast. Welcome.
Thank you very much, ma'am.
All right, so I want to cash in on this opportunity of having you here to talk about many things. First of all, how has it been for you attending a training like this where the theme is strategic insight? How relevant is that at a time like this?
It's a thing of joy for me to be here to join my course mates in this training organized by National Institute of Policy and Strategic Studies, CRU, in collaboration with Africa Development Studies. It has been, in fact, exciting to me because anything policy and strategy is very, very important to me, especially in this period that is actually complex and uncertain and ambiguous. So to navigate those complexities, you need such rethinking to move my institution forward.
Okay, so talking about data-driven decision making, would you say this is coming handy, like the right time is a step in the right direction? And how would you say this will help you in your own field, to make better decisions?
I love data as a scientist because for you to make science informed, you need data. Coming here today to refresh my knowledge about data-driven leadership is quite exciting to me because without data, you are just in the dark. So I really appreciate the organizers of this conference, this course for top-level managers for introducing this course, and I was able to refresh my knowledge about the first 5 steps in data decision making. To me, I look at it as data-driven leadership. That is the only way to go in a country like ours. Anything that is not based on data is in the dark. So we really need to have a better foundation. You want to have a better foundation, you need to talk about data, make use of data to enable you to make science-informed decisions. That is my thinking, and I'm happy to be here. Okay. And I can tell you that I benefited from the course, and I'm also happy that I was able to participate actively during the period.
Okay, great. So before now, would you say there are key challenges that you would say that these have actually directly addressed? Key challenges. So would you like to highlight some of them?
In a hotel setting like ours, when I took over the chief medical director, I wanted to know what my customer feel about my services. So I need to collect data, to have a business data. But I know the problem exists. What are those problems? If they exist, what are the magnitude of these problems? So I needed to do some survey to collect data to know areas where most challenges exist so that I can tackle the problem by developing appropriate strategies. So they exist everywhere. One was the waiting time in clinic. So I wanted to know how long for a doctor-patient, before a patient can see a doctor. I did that. I went to my emergency unit. I want to know time to intervention rate. I needed to know the data so that I can develop appropriate strategy to reduce that time to increase my customer satisfaction.
All right, so in doing that, I'm sure you set up a kind of feedback mechanism to get feedback from the customers or consumers, in this case, that happen to be patients, because you work in a hospital. In there was an interaction amongst the your classmates here at the training and the facilitator. And the conversation was about who to get the feedback to or the information to after data is being collected for a particular purpose. So in that case, you ensured that you got the information that could help you in appraising the situation and coming up with policies. Let's take it to a national level in Nigeria. where there are different agencies, different departments, and policies are being made. Let's say the number one citizen, the president of the country, wants to effect change in certain quarters. What should be the way of ensuring that the data, as it is, gets back to the right quarters without any of it being tampered with, so that the right decisions can be taken? Because sometimes there is data collection, but at the point where the data should be used, it doesn't reflect the way it should be, or even the interpretation.
Thank you very much. First of all, we start with data. The data analysis is used. Analyze data without presentation, and if decisions are not taken, very, very easy. So in my country, like Nigeria, I think the health sector as a case study, we already have a system in place. Luckily for us, we have the president, the chairman of the Government Council, in which I can serve ministers who are members of the Government Council. I am directly reporting to the minister. What I think, it is my duty to collect data, analyze them, present to the minister, into a useful form, which other agencies will also do. We in the position to play the president for proper decision making. That is one way in which you can play at national level. But let me say at the hospital level, what I have done is I have created a department of service improvement, which we have Servicom, we collect data, which analyze every Thursday in the week, what we know what we are doing, then we take decisions. So we focus on this thing. Like my example, I know my own is not working well. I know the data is not working well. It's from data. I have to just make use of the data, information from the data, and take appropriate decision. Today, I can tell you from the, let me say, second quarter survey, the result I'm seeing is a little better than what I saw in the first quarter. So I can tell data is important. It's also necessary for the right person who will make decisions using big data. The person is there, the minister is there, the CEOs are also there.
Okay, so now let's get to your hospital proper, and not just your hospital, but the health sector in Nigeria. Sometime in this year, it was cholera. That was the epidemic that was being dealt with. So far, the health sector have been able to manage the situation. It's not about cholera anymore. Now it's monkeypox. What's going on? What are the issues? What is the situation like with monkeypox outbreak in Nigeria? What can you tell us about it?
Monkeypox, I would say this has been reversed, but periodic upsurge does exist. Right now we are having outbreak, and the WHO has actually declared as a disease of international public health emergency, so it can be declared. But about 3 years ago, there was an outbreak too, which we all work together, and part of my local team who work at NHOS. We were working on it before the disease went down. We were ready for trial using certain indication for the disease. So there was one for everything went down. Now we are having lots of again. So that's coming again. Luckily for me, my hospital is the only tertiary infectious disease hospital in the country. We have a teaching hospital. We have the capacity to diagnose any virus using PCR. We are capable of making 25 pathogens a day. We have all the parameters. We made us go MPOS. As of this point in Nigeria, I want to know that we have 2 new cases of MPOS in the hospital. So, whereas about 2 or 3 weeks ago we don't have any, but right now we have 2 confirmed cases of MPOS. it's a disease that is with us. I don't really know more about it. I've already had the community health department to create awareness so that many people will not be affected by this disease. I'm a nutrition and gynecology. One of our people will come is NPOS in pregnancies. It's online, and I was opportunity to develop how people who are pregnant with NPOS, how they deliver to prevent mother to child transmission. It's well written and it's actually available. We published in Legacy Major Infection Disease Journal, and with the group of all Nigeria. I think that's one of the first papers in the software.
Okay.
And we did that. So, NCDC doing its job, we also doing ours to help the country to make sure that Nigerians are not really affected.
Okay. So, somehow everything is experiencing change. Monkeypox, mpox. When I saw mpox, which one is mpox? So, doing a bit of research, I realized that the very first case in Nigeria started was in 1947 by a 4-year-old girl, and somehow the mother also got it from her. That was the first human-to-human, transmission. And I read further, I got to realize that this came from animal or all of that. So if that baby 4-year-old got it and they couldn't trace where that happened from, so can you just tell us specifically the cause? Now let's talk about the transmission, and again, what was the exact cause? Where did it start from? Is it truly from animal, or it's something entirely? I mean, we just want people to have this knowledge so they don't go about with false information or unclear details,
Okay. Initially, what we do is we get from animal to human. Human to human transmission without interval phase of transmission. It does happen like that. It's going to be handled from any animal right now. So contact with infected people, we also their infected products, blood products, body fluid can lead to that. That one is well established. But for having a baby with that, a baby could get it from even fellow babies, can be from mother to baby, can also be from just any other sources, if possible. But if you really want to know where the present outbreak is coming from, the only thing you can do is to do what's called genomic surveillance, to trace it to the root where it's coming from. You now say, this outbreak, where is it from? Is it from human to human, or from animal to human? Yeah, human to human. Which one occurs most? It's going to be from surveillance. You have to do what's called sequencing and trace it to the origin to really confirm. We do it for Lassa fever every year because we want to always know where is that coming from.
It's coming
is it
from
a new one? Is it from rat to human or human to human? What is the major mode, the source of it? The origin is always coming from rat to human. So also if you want to know this, when you sequence to know where this particular outbreak is coming from. Without that, we cannot say much.
Okay.
Let's also talk about prevention. Yes, it is out there, and especially I think they're looking at it more predominantly in Africa at the moment. Like DR Congo, they had these severe cases. So prevention, what do people need to do back to back to ensure that they are safe?
Well, we have 3 levels of prevention. The first one is becoming awareness. And that we are doing to let the public know that mpox is right and left. This is what we are going to do is human to and this is human transmission. Of course, if we are the rest of the days are affected, definitely we are affected. Our daily life, education, all parts of the economy, we don't want that. So the first thing we are going to do is to create awareness by using electronic media, using leaflet, also what effort is about. The other one is what? Is to when people are affected, you treat them in the isolated environment so that you don't have contact with what do you do? But the rest of it, the previous property, that's how we should. The first thing is to contain it, yeah? Let's put it in. And use it to just make other people. So I think what we are doing right now is the primary level. Let's create awareness.
Okay.
Let people know such a thing exists.
All right.
Okay.
Now that people are getting to know it does exist, are there certain areas that in your research, in your study now, or observation, you found that are more prone to this infection? Is it more common in certain areas? I'm talking about treatment. Is a treatment available here? Is it something that, oh, when a person has it, the person can be treated and gets well?
Okay, I will talk from experience. I have not really looked at the distribution of the endpoints in Nigeria as of today. But what I know in my environment, I have to persist today.
Is this something that is more common in the rural area than in urban centers?
We need to do some analysis for us to know. We need to do some analysis. We want to look at people who are affected. When you put them together, you do the analysis. I will not say they are not common in urban, or let us put this and analyze them. We are going back to data where we are coming from. Data will not speak at the end of the day. So, where are these people coming from? We can't make such statement today. I can say maybe the next 1 month we'll make such a statement. But always, the people of low socioeconomic class, they are more likely to have it. That is what I'm seeing right away. But let us wait a little bit so I can do proper analysis, collect proper data so I can make such statement so I will not mislead
The people. All right, what about symptoms? What are those symptoms that one should watch out for? People should watch out for in themselves and in others. You see a person with this and that, you know, oh, I'm to keep away because that person may be coming down with monkeypox.
What I will say, to make it simple, I don't know if people are concerned with chickenpox.
Yes.
But this one is more than that. And what we know is that it's not common in some areas in the body, like maybe the perineum, the armpit, but it can also be generalized. It can be general, do you understand? But the rash is a little bit different from that of chickenpox in a way. When you see anything like have a rash, we call it a rash that are a little bigger than that. That also, we also have pains and fever.
Are they like rash that are boil-like?
They are boil-like, so they are unsightly. Do you understand? Suspect any rash that for this period, any rash that are more than unusual, we suspect. And this is very hospital. Doctor will be able to define it better. One of my doctors was able to create an atlas of endpoints presentation. It's available in the net. Dr. Seb Ayo is a dermatologist. He is also working with the WHO. He is one of those who contributed to create an atlas on what you can see. We also presented the paper on atypical presentation of endpoints. We did that, and that one is published, is available online to know what we saw from that study. It's also there. So maybe I don't know, we can just go and look at atypical presentation of endpoints. That one by Seb, I wrote myself, and Professor Kubuni. We did that. We try to help our people to realize that endpoints can also present in an unusual way, not always the way you are saying on television or on leaflets.
Okay, so let me ask you. Let's talk about vaccine for monkeypox. You know, when it comes to vaccination from other part of the world, let me say the Western world, it's more like it's a go-to thing. They don't really bother much. But here in this part of the world, when you hear vaccine, people are like, oh no. So what's the position of vaccine at the moment for monkeypox, mpox, okay, mpox? How are people reacting, do you think? Because I read a piece of information saying that Nigerians are not really, you know, in for it, you know. So I want you to speak to this.
Like any of that, Nigerians are, okay, let me say, by saying especially Nigeria, I don't know. It's like the myth of the matter. I don't know when the years are like that. Nigeria try to go with more with information Vaccine is actually available, but it's not available for every person. So that is why they are trying to do it there. To use the smallpox vaccine of 40 days to see whether it will work for mpox. So that one was already there, but polio was the problem. I think with the new surge now, polio will become available. For what to do is called the MOSA trial. MOSA trial. And they used to use that's to see whether it will work for mpox. That one has not really come. But we need to educate our people. You understand? Wrong information go out here very fast before they really need information. Just like COVID, people are not ready to take COVID vaccine. But I believe in more in community engagement with our people, educate them. Really, hear from their own perspective so you can change it and with better one. That's what I think. It's something that the vaccine centers among Nigerians is quite low. We have government. If you look at the vaccine for human papillomavirus, then the long run prevents beta cancer. Nigeria are not going to take them, even when they are free. It's not their fault. It's misinformation. It's not Nigerian fault. But I know that some people use their money to purchase that vaccine to give their children. Also, buy a dose for as much as 2,000. But government provided free, but they're ready to take it. It's not still the people's problem. It's government buying without knowing the people's taxation. About the vaccine. They need to correct all that before purchase of those vaccine.
All right, so let's look at some policies that should be made against epidemics like this. You know, during the time of Ebola, there were awareness campaigns and there were talk about, people should avoid eating animals from the bush, what we call bushmeat here. And during the COVID-19 era, there were also policies that affect the transportation sector to prevent people from being too close, that physical contact. So in buses, in public transport system where you have 4 passengers per seat, it was brought down to 3 passengers. For social events, more than 50 persons were not allowed to converge within a hall to give that social distancing, that's physical distancing. So in a time like this, are there certain policies that can help the prevention of the spread of monkeypox?
What I say, I don't think we need such responsibility for government, but advice. Right now is for us to keep on job hygiene. We got to be a solution, like hand washing, still doing what I'm supposed to do to prevent contact with other people, especially those people with lesions, all those personal protective,
personal hygiene
hygiene
practice.
is very, very important. That's what I'm saying. I don't know what we used to define the market right now, where they are, but I feel that if you take appropriate measures like hand washing, personal hygiene, avoiding contact with people who are infected, we really help. For us who are working in hospital, we take more protective measures, like wearing personal protective gadgets in managing those patients who are infected with mpox. I have to put this in isolation ward. That is a measure. Nursing there in isolation ward is a public health measure that is well known to prevent person to person
Transmission.
Okay, so perhaps, I don't know if you still have more questions, but I just want to take him back to the class, right? Okay. So,
before the class.
Okay. All right.
All right. Before the class, let's just, can you talk to those who are watching? Because whenever people hear things like this, it sort of brings this fear. People are thinking, I don't know what's happening. There's mpox now. So it means that one has to be careful. You never can tell where you get it from. And you've talked about what your own institution is doing to prevent and even to curtail the spread. What should be the approach nationally? What has helped your own hospital? Is it because you have the equipment? Is it because it's an attitude thing and so you're proactive? What exactly is making it easy for area specialist teaching hospital to be able to combat a situation like this, an epidemic like this, as you have been able to combat Lassa fever, COVID-19? What should be the approach for the health sector?
Thank you very much for this important question. Area Teaching Hospital has been in the forefront to deal with infectious diseases, especially viral. Lassa fever, yellow fever, dengue, even COVID-19. Anything called viral hemorrhagic viruses, we are specialists in that. We have been doing that. And I can tell you one of the major breakthrough for you was the ability to make diagnosis. That's what really helped us. I can tell you as a country. We were able to make diagnosis for viruses using latest technology as far as 2007. So since then, there is no day we don't have a setup for any of those viruses like Lassa, even COVID. We do it almost every day. So that's one of the major strong points for Iraq. From there, we grew to become experts in case management. From there, we developed our public health unit to create awareness. For this endpoints, they have already developed their own case definition, public awareness leaflets, education of our staff. We call it the internal community first, before the external community. We start educating them about it. It's what we do every day, so it's actually part of us. I can tell you one of the things that are helping us is the ability to make diagnosis. Doing that is the human resource. We have trained our our scientists all over the world. In US, China, Germany, France, in all the major institutions, we are able to train them. I can tell you right now, there is no day, no member of my laboratory will not be as in the country. We are able to develop that kind of partnership with international institutions over the world. Today, people are moving to Germany today. As I'm here, they are moving to Germany to develop their mobile laboratory. You can move to any area in Nigeria. In February, we Kaduna, the reference hospital, to help them to contain Lassa fever by moving our mobile laboratory. You can see the engine of IRWA is what? Able to make what?
Diagnosis.
It's not just suspecting. You say this is a virus. This is not a virus. This is NPOS. This is not NPOS. You can make a double NPOS. This is NPOS. This is not NPOS. We can tell you. Once you're able to diagnose, you have no, we call it root cause of the problem. For root cause of the problem, you can't look at, you go to what? How you can overcome such a problem. That's our major strong point, our major, we call it, when you talk about diagnosis, it's IRWA. If you say it is yes, because we have never stopped for how many years? More than what?
So how can this be replicated nationwide? We find that medical tourism is one way in which Nigeria's resources leave the country. People go out to India to find treatment for whatever ailment they may have. So if IRWA is doing this, how can it be replicated so that people can have treatment in Nigeria without having to travel abroad? Diagnosis and treatments.
Nigeria is a blessed country. The only problem we have is our behavior. I believe that if a system can rewire the people's behavior, we can rewire the system. Because the government tried to replicate molecular diagnostic equipment all over the country. From our survey, which I was mandated to do by my committee, only 40% of those equipment government bought all over the country are really functioning. Okay. How many of them are doing that diagnosis every day? They are not to about 10%. So it's a problem. You don't really blame them. It's has to do with our behavior, our commitment. the country had to develop a way to make people to be consistently committed to doing the right thing. How do that? How to do with training and other things to retain your staff. Motivation must not be a form of money. I have got to do that. Motivation can be in terms of recognition. People have been fighting for recognition. Eventually, we got it from the outside world before the country recognizes us. What really helps us is that consistent commitment to prevent brother and sister from dying from just a matter from viruses. It can be done actually. I think the country invested a lot in doing that. It's not left for us to to keep on doing the right thing. That is what I really think. There's no day I will not have the result of my PCR in my pocket, in my phone, by the end of today. Whether I open it or not, they know that I'm going to look at it.
What's your PCR?
PCR, polymerase chain reaction.
You know we're not in your field.
Yeah,
and those watching, some of them are not in your field.
Molecular diagnosis.
Okay.
Using PCR is a technology.
Okay.
Thank you.
Retainership,
Yeah,
Yes. I mean, Blessing mentioned earlier that you see people travel abroad for medical treatments and all of that. So let's also look at having our doctors travel abroad to stay over there to work rather than keeping them here. You understand? So you've mentioned about your strong point. You've talked about your strong point, what you people can do best. So how about the place of the government to ensure that these people are really, ready to stay? To ensure, even when they are not ready to stay. I mean, you've talked about incentive. Did you say incentive now? Motivation now, not necessarily by cash, but there are basic things that I feel maybe government have to do that will encourage these people and keep them. I mean, how about that? And again, you talked about training. Must all of the training be outside? Yesterday we had this conversation, and I was talking about why do we have to always go abroad for training? Why don't we have those people come over to even do the training here? All of this put together, what do you have to say?
Yes, but government is like the father.
So he's the president, fine, and all the other layers of government, But what we need to do for ourselves is retention. Actually, it's a benefit for each of people go outside. It's benefit to us. But the way they go, they are come back home. There are many benefits of that. Fine, if government knows that is a problem, as they are doing right now, why can't you increase the population of people who are only qualified to work here? If they go out, they don't mean to us. That's they are coming back. They can come back. Even they go back, they can go back. There is always the way they come back. They don't carry their whole family away. They have brother, they have sister, they have father. Their parents is surrounded with them. One day they will also come back to bring technology back home. If they develop through that, they brought technology back home. Oh, let us go home to go and develop our home. There's no way they will not come home.
So sorry, let me chip in. Should we get to that point where until they have to go abroad and come back before we appreciate what we have? Why don't we have them, those here doing something that we will appreciate rather than waiting for those that have stepped out to come in first before we begin to say, oh, we have the good hands?
It's for government to massive. When they go to our they are all happy on doing what I'm telling you right now. You understand? If for you to have those regional, what do you call it, a laboratory, for example, develop them. People who are really doing something and they are seeing the result, they will not go anywhere. I can tell you. If they start what you are doing, like for example, if I'm managing my hospital, I'm seeing results. That might be my motivation or results. Support, recognition might be my motivation to stay. Many of our people, they don't feel satisfied because what recognition, important. Of course, finance is another problem. With our economy, the way our economy is behaving, we also encourage people. You understand? But is a multi-factor that drive that limit retention of what Nigerians. To me, one of the first things to do is to increase the number. Because we have institutions in Nigeria that can actually increase the number of doctors, nurses in Nigeria. Like I was very happy that the way the president announced 5 new medical centers with College of Nursing in Ekpere, in College of Nursing, we have one in Busan, in Bauchi, so and the other hospital with College of Nursing. That means they want to increase the number of nurses actively in the country. By some to even if some leave, we still have some remaining. I told you there's not always disadvantage just for them to do. It's also an opinion. For example, I can go to UK and meet the Nigerian doctors. They will get to training. They will give me the secret of infectology. It's also an opinion. I don't. To actually stop it will be very difficult, I can tell you. The best thing to do right now is to increase the number of personnel, which the students are capable of doing.
All right, so as we wrap up, coming back to the training, so now that the conversation is about strategic thinking, strategic insights, and planning, what are you expecting to see happen in the nation's public organizations and even the private sector at the end of this, since it's top-level managers that have gathered here and are going to be trained? What kind of new developments, what kind of happenings are you expecting to come out as a result of this?
Not I expect a positive change in my organization because as a company manager, I believe in strategic leadership. That when you not only develop strategy, you also develop implementations of your strategy, not just be a leader. You must implement your strategy in a way that develops appropriate implementation strategy. Because implementation strategy, you have strategy, you also have implementation strategy on how to do that. That is the way you actually move forward. When you think that way, your mission is big and your vision is sharp. That is so I am here to sharpen my vision and to be for my organization. So I want to build something like that.
Okay. Thank you so much. Thank you very much, Professor Ruben Agbons, who is the Chief Medical Director, Area Specialist Teaching Hospital, Edo State, and he is a participant here at the NIPS ADSC training for top-level managers on strategic insight. NIPS, National Institute for Policy and Strategic Studies, in collaboration with African Development Studies Center. And this training continues. So podcast is here bringing you highlights of the event and also bringing to you some of the participants. We'll still have to bring to you some of the facilitators. We do not fail on our promise. Eventually, you get to meet them. Stay. Good to know that you're still with us on Souq Podcast today, and we're bringing to you the highlights of the ongoing NIPS and ADSC training for top-level managers. In case you're wondering again, what is NIPS? I'll tell you. So it is the National Institute for Policy and Strategic Studies. They've come together with African Development Studies Center, ADSC, to organize a training for upskilling for top-level managers in the public and private sector. If you've been following the show today so far, we've been talking with, we had a conversation with the Chief Medical Director of Area Specialist Teaching Hospital, but away from the healthcare sector, because those who are represented in this training are not just those from the healthcare sector. We also have someone from the Legal Aid Council of Nigeria. She is Latifat Salau Esquire. I like to add that, even though she says, I'm just Latifat Salau, she's a legal practitioner and she works for Legal Aid Council of Nigeria. Good to have you on the podcast.
Thank you very much for having me on this program.
So in this training, we see that there are many of you from different sectors, different areas. Yes, I just mentioned that earlier we had a conversation with the Chief Medical Director from the Area Specialist Teaching Hospital, and you are from the Legal Aid Council. Now, if we are to look at how to position Nigeria, because in the course of the training session today, there was a case study on how to position Nigeria in the Committee of Nations in spite of the challenges that the country faces. And the theme for this training so far has been strategic insight. What kind of strategic insight and planning would Nigeria need to position the country rightly? You were a team lead for your group.
We have a positive mind change. We need to reorientate ourselves to know that if we don't change what is in us, we'll never get a change. We all need to work hand in hand, everybody, both the led and the leaders, to make sure that we get positive vibes out for Nigeria. When we have that change of heart about doing only the positive things, let us project Nigeria in a very positive light. Enough of all the negativities. We need to be positive and project Nigeria in a positive light to be able to get other people to take us seriously. If we want Nigeria to move forward, then we have to take Nigeria in a positive light to the whole world out there. Otherwise, nobody will take us seriously.
Okay, so obviously there will be one challenge or the other which you experience from your sector, and they say that somehow we are the problem of ourselves. So how do you deal with difficult people when it comes to delivering your job? How do you handle difficult people?
When you come across a difficult person in the line of the job, you try to look at where they're coming from. What is exactly the problem that is making them difficult? It could be family, it could be individual, it could just be that mindset that I earlier talked about. So when we get the person to see the reason we need to make Nigeria work, the person will have to drop that difficulty and work along with everybody in the organization.
Okay, so talking about data-driven decision making, I think I'm still going to talk about challenges. So do you find it very easy getting the right data to take some specific decision?
Yes, in my organization we have a unit that deals with data. There are qualified statisticians who are employed in that unit to do the work. Although it's a bit difficult at times, but at the end of the day, because the Legal Aid Council have representation in all the 36 states of the country, so to get people to send in their information in good time is a bit of a challenge, but at the end of the day, we always get the correct data from the states.
Talking more now about the Legal Aid Council, justice is something that every human being seeks. At some point in time, people may need to have justice for themselves, whether it's about a wrong that's been done them. But you know that legal services is expensive, and I'm sure that's why the Legal Aid Council exists. But looking at the number or the number of lawyers that Nigeria has to the population, what can be done to ensure that every Nigerian has that sense of belonging, regardless of their status, when there is a need for justice, when there is need for someone to advocate for them, they are not denied that right? How can the country strategically defend the right of its citizens to ensure that citizens have access to defense?
The federal government sets up the Legal Aid Council with the main aim of providing access to qualitative legal representation in various courts. There's no denying the fact that Legal Aid Council is not, Legal Aid Council cannot deliver the legal practice that cannot represent everybody because of the sheer number of people who are involved. This is why the Legal Aid Council, we have collaboration with other bodies, the MBA, the private practitioners. They work hand in hand with the Legal Aid Council so that we can get to as much people as possible The private practitioners, they do pro bono services, and in doing this, we are able to get across to as many people as possible. There is still room for more, actually, but then we are doing the best in the circumstance.
All right, not to take much of your time because you need to return back to the training, but you touched on a very critical point, and that's getting the right narrative out of Nigeria. For some persons that perhaps at the point they thought all hope is gone because they can't afford the services of a lawyer, maybe the legal aid services came to their rescue. How do we get the narratives of things that are working out of Nigeria or circulating so that maybe it can restore faith in Nigeria? It can help people know that if this can work, maybe in their own areas, they too can do something to make the country work, and by that, Nigeria is positioned rightly in the common view of nations.
That's where the media comes into play. When the Legal Aid Council, activities of the council gets out in the public, it will go a long way to sensitize the people about the availability of these services, so that those outside the country will know that, okay, there's justice for everybody through the Legal Aid Council. Notwithstanding your strata in the society, you could be the poorest person. The Legal Aid Council is always there to render the services required.
Okay, I think I'd like to take this before we let you go, right? Talking about time duration for delivery, because most times you hear people say, oh, you want to take this matter to court, you are going to spend the whole years and all of that, pushing it, and at the end of the day, you probably might not get favorable results, or you won't even hear anything at all. So, talking about Legal Aid Council, how well are you ensuring that whatever you push in, it takes just adequate time, not necessarily spending time before results, have been pushed out?
That's not in the powers of the council to decide when a matter will end. Once a matter gets into court, it's the courts that will determine when a matter will end. But on the part of the legal aid, the much we can do is to ensure that on every adjourned date, when a matter is in court, the Legal Aid Council is present in court to represent the client, so that there will be no delay in delivery of justice for the poor man. And I dare say that in recent time, there has been improvement in the delivery time of our courts. So we are looking forward to better times to come.
Okay, we hope that eventually the justice system gets some speed, because you know what they say, justice delayed sometimes can be justice denied. It's not when a person has died that maybe verdict on a particular case will be delivered, so who benefits from that verdict anymore? But we just hope that the necessary things to be done, particularly with this training, strategic insight and planning, we'll see changes. Thank you so much, Latifat Salau, who's a legal practitioner with Legal Aid Council of Nigeria, for speaking with us today on Souq Podcast. It's been a pleasure having you here.
Thank you. It's my pleasure too.
Thank you so much.
Thank you.
And finally, the resource person for today's session, and he is Maurice Ekbong, Director, African Journal for Sustainable Development. Oh yes, it's been a wonderful session. I wish we could actually bring you videos of that, but hey, like Will mentioned, this is something that some persons have had to pay for, so you can't just have everything. But you're getting a lot from it. So, Maurice Ekbong, it's been a wonderful session in there. A debate on how to move Nigeria forward, what kind of strategic thinking Nigeria needs to move it forward. And you've moderated the session, you've been the resource person. From your own standpoint, what do you think fundamentally are some of the issues that has hindered growth and development in Nigeria? And from the session, do you think Nigeria is getting it right, exploring the mindset of the participants?
Yes, thank you very much. What are the fundamental challenges? If you look at the session that we took today, basically, how to make data-driven decisions, right? The key thing is we don't have data that has integrity in Nigeria. We don't have the right quality of data. So when you don't have the right data, the decisions you make will be faulty. So that's like at the base, right? So we need to improve on the quality of our data so that the decisions we make can actually solve the problems that they are intended to solve.
Talking about data-driven decision making, you actually broke it down, bringing different aspects of it. Data literacy, what role does it play in all of this?
I mean, first of all, literacy is at the bottom again of whatever it is that you build as a nation. You need to have people that understand the challenges, understand their roles, in ensuring development at their own small, level. So data literacy is important, right? Data literacy is important. We must, as a people, see how the little decisions we make, right, impact on the quality of decision. I made mention that if, for instance, government were to start, say, something to empower people, you will find Nigerians picking up the records. You'll find a lot of people, lying about the size of their households just to benefit more. So all of these impact development because they take resources from places where they are needed to places where they are not needed. So when that happens, you have uneven development. So we must understand the impact of the little decisions we make at our small spaces, small corners on the entire development of the country.
So in there, the part of the debate was about Nigeria or Africa creating a new narrative. Now, there is no point denying the fact that for a lot of technology, lots of things that Africans use, Africa depends on the West. Now, providing this new information with data that will lead to a disruption of the normal or what has been known over the years, and Africa charting its own course, defining its own development, would take a lot. What are your thoughts on this?
Yeah, I mean, so definitely, if Africa comes of age, it will definitely mean, upturning the apple cart, if you will, stepping on toes, changing the dynamics. So some people will not be very happy, but we have to take our destiny into our own hands as a people, and move forward fundamentally. The interest of Africa and Africans must be paramount, before we consider the interest of other external parties. So if that means renegotiating our relationships with our partners, so be it. But we cannot have a situation where people continue to exploit Africa, and take the resources of the continent outside of the continent. We can't continue, that trajectory if we want to see development happen in the next couple of years.
So you also made mention of Nigeria depending on the West, to do some major things, and at the same time seeking for validation. And at that point, you see some information being, cut down, even not getting to the level where it's supposed to get to. What do you think Nigeria can do differently to change the face of things?
I mean, first of all, realize that, you can be self-reliant. I mean, a nation of 200 million people is a self-sustaining market. You have all the resources, you have land, you can farm, you can grow the different foods that you eat. You have different mineral resources, crude oil. You now have a refinery and several on stream. So basically, you can be self-reliant. How did America develop? America didn't develop from selling to anybody. America developed by developing its resources. You had entrepreneurs who invested in rail, who invested in infrastructure, in sea transport and all of that. And that was the basis for their industrial development. If you have 200 million people, right, as we have, and you have land as we have, how much really do you really need? You have the expertise, you have engineers, you have professors, you have people who have research capabilities, who can innovate and solve our practical problems. So there's no fear in terms of what can happen if we decide to take our future into our own hands.
But circulation and acceptance within ourselves.
Yeah, so we also need a lot of education, right? Because if you say made in Nigeria, a lot of people will be like, no, made in Aba, no. But you know, I remember back in the day, made in Taiwan was something that people laughed at, right? If you say this thing is from Taiwan, oh, Taiwan. But today, Taiwan is top quality. So you have to start, it's okay to start from imitation, from copy, as long as you are constantly improving. So we must eat our own food. We must drive our own cars. We must wear our own clothes. You know, that's the starting point. There's nothing, you know, shameful in being African, right? In identifying with Africa, and therefore using the local resources, you know, to meet the aspirations of the people. Part of the challenge that I see is that we are trying to be people that we are not, right? We left the tradition and the culture of our forefathers in quest to become like the Oyibo man, in quotes. Now we are like a bat because we are not the Oyibo man and we are not the African. We are somewhere in the middle. So we are lost. We fundamentally need to go back to where we are coming from and say, look, this is who we are. These are the values that stand us out. And therefore, this is how we want to define ourselves without fear of what people will think about us. Right? Yeah.
All right. You talked about we're trying to impress, and there's a way they say it in the street. Who do you want to impress? In Pidgin, they say, who you want to impress? Well, the person to impress or people to impress should be Africans, trying to impress Africans. Because at the end of the day, it comes back to what Africa needs and what Africa wants. And I think we should also begin from collecting our own data. Africa should collect data relevant to the development of Africa by Africans.
Correct.
That way, we can have authentic data, and everyone should just know that it's for the benefit of the nation, it's for the benefit of the continent. Thank you so much, Maurice Ekpong, who is Director, African Journal for Sustainable Development. He's been the facilitator for the second day of the National Institute for Policy and Strategic Studies training in collaboration with African Development Studies Center. This is where we wrap today's edition of Souq Podcast. The special series, Strategic Thinking, continues in the next edition. I'm Blessing AJ and have been here with
Grace Komolafe. See you tomorrow. Bye.
See you in the next. Bye.